There is a 45-year-old man who presents to surgery clinic with ulcer on his left feet, which he noticed a week ago. He was surprised by large size of ulcer because he never noticed it, and it was asymptomatic. The man also noticed fluid oozing out of ulcer, which he has been wiping off with a clean cloth. He has diabetes mellitus for past 10 years and hypertension for past 8 years. Medication include metformin and enalapril, though he tends not to take them as directed. His vital signs are normal. His foot reveals a 3 into 3 centimeter ulcer with irregular border and clear fluid over the base and erythema in the surrounding skin. Image is shown below. Lab examination shows that blood glucose is high, hemoglobin is low, RBC count is WBC is a bit increased, ESR is high. Physician recommends debridement and prescribes antibiotic for 1 week. Patient is also told to control his blood sugar by taking medication regularly and paying better attention to his diet. He is also advised to change his dressing daily for next 7 days. After 1 week, the patients also begin to heal. Which of the following describes the healing process of this patient? This patient is having diabetes and he presents with this ulcer. So what kind of healing will we see? So again, as I described in the question 1, that in a diabetic ulcer or in any kind of irregular wound which is not an incised wound, the healing process is by secondary intention. So let's see what option did we have and why. So it is written that a greater volume of granulation tissue will be formed during healing by secondary intention, which results in larger scar formation following wound contraction. So as I said, let's assume this is our ulcer. There will be a lot of granulation tissue covering the large size of the wound, and then there will be deposition of collagen and other connective tissue which will undergo contraction, and that contraction will lead to scar formation. Larger the size of wound, larger the size of scar. During the process of healing, large tissue defects have greater volume of necrotic debris, exudate and fibrin that aid with healing. So this is true that if a large defect is there, there is going to be greater volume of debris, exudate and fibrin, but this does not aid in healing. In any kind of, whether the wound is large, whether the wound is small, it doesn't matter. If there are any kind of debris, exudate, or if the base of the wound is not clean, it slows down the healing process. So that is why you usually debride all the exudates and necrotic debris before letting the wound to heal by itself. During healing by secondary intention, a small scar is formed with minimal wound contraction. Wrong. Since the wound is large, there will be a large scar with enough contraction. In this type of healing, the inflammatory reaction is not intense and healing completes within 2 weeks. Wrong. Due to this entire large amount of granulation tissue, there is a lot of inflammation. There are a lot of inflammatory cells that come around this granulation tissue. So there is quite a lot of inflammation, and it does not complete in 2 weeks. It takes almost a month to get completed, 4 to 6 weeks. And the last option was during healing by secondary inflammation. During the healing process, the narrow space is first filled with fibrin blood clot, granulation tissue is formed later and covered by new epithelium. So wrong. This is the description of primary intention. There is no narrow space. There is usually a big wound as shown in this image. So there is no narrow space. There is no fibrin blood clot. There is direct formation of granulation tissue. So this was all about healing of wound.
Thanks for watching. Please give a thumbs up and subscribe for more.